Wow. One of the versions of the original Drum Talk TV theme going back 13 years.
I love it.
January. Yeah, I do too.
I feel like I'm back in the 80s again, like 80s rock, like, right?
Yeah. So that would make me, depending on the year, well, in my 20s, I'll take it.
Yeah, I
Oops.
was in my single digits.
Well, now for you to give that away is no big deal. For me to give away what I did, anyhow, hey
20
everybody.
20 isn't bad.
Yes, the last show of the year for Drumming Injury Talk. Dan Shinder here with Janice Ying, physical therapist based in Los Angeles, works exclusively in the music industry with repetitive motion injuries. This would include, and Janice will let me know if I've left anything out, sciatica, carpal tunnel, tendonitis, bursitis, arthritis, your momitis, husbanditis, lead singer bending your ear, talking too much about himself, itis. Did I miss anything?
No, I think that's about it. You've covered all of them. No, it's good.
Good. And folks, we encourage you to chime in. Let us know where you're watching from, even if it's on the archive. We're broadcasting live right now on the Drum Talk TV Facebook page and YouTube channel. If you have questions for Janice, there's a QR code for $100 you can scan and she'll, no, I'm kidding. If you have questions, I'll relay them and Janice will answer them. But she does do virtual physical therapy consulting, and she's based in LA, like right in the heart of LA, right?
Yeah, right in downtown. That's where I am. So it's pretty easy for most people to get to. And musicians are used to traveling anyway. So
yeah, and I, as you know, I grew up in the Valley. I worked all over LA as a musician and otherwise. What are like the cross streets basically?
11th and Grand. So right next to Staples Center, like 3 blocks east of Staples Center, or I guess they call it Crypto.com Arena now. But it'll always be Staples Center in my book.
Yeah, gotcha. Just like the Forum. It was the Fabulous Forum, then the Great Western Forum, and then the
right.
Josephine's Buttery Margarine Forum or something. I don't know. I remember the Coors Amphitheater in Chula Vista. I remember when it was built. My friend was in charge of building it and was the manager of the facility. And then it's got the cricket arena or amphitheater. To me, it's still the Coors Amphitheater.
Yeah. It'll always be the Staples Center for me. But yeah, I'm right in there is like the Grammy Museum is in that like block. And so like, yeah, I mean, it's a great center, a lot of activity to be around. So yeah.
That's great.
Yeah, I've loved it.
So let's start with this, folks. I'm gonna, and like I said, folks, you can ask questions. Janice, it's the end of the year almost, basically. It's pretty much the end of the working year. We do this show once a month, by the way, folks. And I told Janice that after this show, she could have the rest of the year off. And her comeback was great. She said, good, I need a break. So what's the most common repetitive motion injury amongst, not necessarily, we'll get down to drummers, but amongst all the musicians you've seen? Give us an estimated count of about how many musicians you've seen and what the most common repetitive motion injury is that you've encountered and helped people with.
How many people have I seen this year? That's a great question. Let's see. I have seen.
And I'm going to take a guess. I'll take a guess. Let's see how close I can get. And folks, I'll tell you what, if you folks want to guess before she gives us the answer, the one who comes the closest, other than me, who lives in the United States, you'll get one of our new Drum Talk TV shirts, which we haven't even released yet. As long as you're in the United States. Yeah, and you have to be watching live. So if you're watching live, whether on YouTube or Facebook, go ahead and comment with how many, and I'll give my guess first. And I'll tell you how I calculate it so that you folks come up with a number. And if you folks, whoever comes closest,
I like this.
Say on either channel, Facebook or YouTube, you'll each get one of our brand new Drum Talk TV designs. They're really cool too.
Do I get one? I feel like I'm being left out of this.
You'll get one if you're close to the right number.
Okay, I'm gonna try. I'm gonna try really hard.
You'll get one. You'll get
the
one.
Right number.
So let me think of some calculations. You do this 5 days a week, right?
Yep. Yeah.
Okay. Let me get out my handy dandy digital abacus, and I'm going to take a guess. that you probably do this about 48 weeks out of the year, right?
Sure.
Okay. And I'm going to say my number is, you've seen, my guess is 960 people this year. So folks, think that's, I took 48 weeks, 5 days a week, and I think I calculated 4 people a day. So that's how I got 960. So folks, throw a guess out there. Crazy guess. Is it less because it takes more time than I'm thinking for her to work with people? Is she quick, just gets them out of there, rings the bell, run your card, get out, I got another one, and maybe the number's a lot higher? Like what do you folks think? So we'll let that sit a little bit, and we'll revisit that in a minute. I see that people are watching. Come on, throw a guess. Throw a guess. If you're in the US, you get a brand new design, not even released yet, Drum Talk TV shirt, which we're debuting at the beginning of the year. And Janice, you'll get one of the vintage ones and a new one, and you'll get to pick out which sayings you want. And there's shirts for non-drummers too. We do have shirts for non-drummers, like, why are drummers so sexy? Anyone can say that, and it's a valid question. Yeah, that's just one of many. Okay, so what do you think the most common ailment is from repetitive motion amongst all the musicians you've seen, not just drummers, but to make it kind of easier, maybe all the musicians you've seen?
All the musicians, overuse wise, I would actually say like a pinched nerve in the neck.
Oh, wow, really?
Yeah.
You sure that's not from a significant other? You sure it's from music?
Could be. Pinched nerve in the neck, closely followed by tendonitis, like a tennis elbow situation. So tendonitis on the outside of the elbow here.
Oh.
Those would probably be my top 2. Number 3 would probably be tendonitis here down by the wrist.
Okay.
The side.
Mostly the right wrist?
It depends on the instrument.
Right. I was just going to ask, maybe a lot of string players, it could be this wrist, right?
Yep.
Just stand-up bass, violin, viola, cello.
Yep.
Okay. And amongst the pinched nerve, is that from carrying the tuba around? Is it getting too crazy dancing and playing the accordion and clogging? Like, what's the pinched nerve, the most common instrument that you saw the most people with? Do you know?
Oh, I would say it's like pretty even, but I've seen a lot of drummers this year, and I've seen a lot of strings players, so like violinists, violists.
So people using bows.
But even like wind instrumentalists, they can get some overuse in these areas, because these muscles here also help people breathe, although they're not the main job of those muscles. So they get overused really quickly.
That's interesting, because I would have thought it might have been in the fingers from working valves on the flute or the sax or trumpet. This, like, I do this all the time. Like, my hand hurts just miming it. Yeah. Without the pressure.
Yeah, I would say like most people do, like at least wind instrumentalists, most people do okay.
With the
clarinetists and oboists, or even like some saxophonists too, they'll get some like thumb pain in through here, because especially on the right side, because there's a little piece, and they actually support the weight of their instrument on that piece. So they can get a lot of overuse tendonitis in through this area. That's pretty common as well.
Okay, I'm going to put the guessing thing in the comments so that people just tuning in can see it. We'll visit that in a little while. Closest to guess. I can't talk and type.
I can't either.
You can riff for me if you want. Talk about maybe what the solution has been for the pinched nerve.
Yeah. So, I mean, most of the time with like the pinched nerve, a lot of times it comes back to like posture, which I know we've talked a lot about here in this show. And posture can look like a lot of different things, and it can mean a lot of different things for different instruments, because people have different playing positions. But Yeah, a lot of times you're really used to seeing people with that like kind of slouched forward head position. And so that just basically narrows the space that the nerves kind of travel out of as they go down into the arms. And so that's a really common thing. Like, even if you don't play the instrument, it's a pretty common thing for people to get, pain in the neck or a pinched nerve in the neck because of the posture itself.
That's interesting.
And tight muscles too. So, yeah, and I was like talking about like the wind instrumentalists having some pinched nerves too, but sometimes it's a little bit different part of the neck. You have muscles here in the neck that also help with breathing or deep taking a breath in. And so if they're not breathing as well from like their diaphragm, then they start overusing these neck muscles here, which can cause some pinching on the nerves.
That's interesting. Do you ever have anyone that overuses their diaphragm and that they have something there?
Yeah, no, not so much. I mean, diaphragm is such a
Made to do that.
large muscle. Yeah, and you use it all the time, even if you're not thinking about it, right? And
Yeah.
so, yeah, that's not really an area that I see people having issues with. Either that, or they'll just be hiccuping all the time because of diaphragm spasms, which wouldn't be fun either.
Right. And I'm making a quick note of what my guess was and that I can't win. So just as a baseline for people, there you go. Let's get your guesses, folks, and we'll revisit that in a bit. Oh, that's weird. YouTube, it split it into two messages, it looks like. We'll get Janice's number in a little bit. But again, just to reiterate, the closest one to guess how many clients Janice saw as a physical therapist on repetitive motion injuries, overuse, doesn't have to be drummers. She works with all kinds of instrumentalists, wins one of our new Drum Talk TV shirt designs that we haven't even debuted yet. We're going to first week of January, and we do have shirts for non-drummers, and one winner from YouTube, one from Facebook, but you got to get your guesses in before we reveal the number. All right, we'll go back to all these ailments.
Yeah.
Do you know about from the drummers? Well, of course you would. From just narrowing it down now to drummers and percussionists, what are the top 3 injuries that you saw? Is posture something affected by posture way up there, like sciatica or neck arches, stuff like that?
Yeah, definitely like the neck. Probably the top thing that I see in drummers is like the tennis elbow situation here. That's probably the number one thing that I'll see. But neck pain for sure. Maybe not like the nerve. I don't think I had any drummers this year with nerve pain from the neck, but definitely neck pain. That's been a pretty common one as well. Yeah, and then just like overuse at the wrist as well. So those are kind of like the top 3 for drummers at least.
Do you get people that come in and they're a musician, whether they play drums or any stand-up bass, double bass, something that is a heavy instrument, and they say, I have an injury, but it's from lugging my stuff around. It's not from
Oh, sure.
playing. Yeah.
Oh, sure. Yeah.
A high rate. What's the couple number 1 or 2 to 3 injuries on that? Just pulled muscles?
Yeah. Pulled muscles, back strain, herniated discs in their lumbar spot, in their low back.
Oh,
so
boy.
that's more
over.
like the sciatica. That's more like your sciatica population, or even just like touring artists. They're sitting so much, right, on the plane, on a bus, in a car, cramped up with all the gear with them.
Yeah.
So a lot of artists who sit a lot, that's where I'll see the kind of like that low back, hip pain, sciatica kind of situation.
Drummers, string players, people who play pianos,
all of
they're
them
sitting, they're
Yeah,
sitting to get there, and they're sitting when they're performing.
yeah, and they're kind of like sitting in awkward positions sometimes, or when they're practicing. But this year I've seen a number of like traumatic injuries in terms of like people falling, breaking their wrist.
Really?
Or breaking their elbow.
What's the increase
maybe
from?
it's a clumsy year. I honestly don't know. I mean, it's not from overuse, right? And so like, so yeah, I've had a number of people this year, maybe more so than past years, where, you know, maybe they broke their wrist, they didn't have surgery, and they're like looking to get back to playing, or they did have surgery and they're looking to get back to playing. So yeah, that was also another thing this year.
Interesting. I was thinking about you yesterday and, you know, thinking about doing the show and everything, and knowing that you're a violinist, it made me think, is there such thing, and how would this work if someone insisted on learning violin or viola as a left-handed player and and the bow's going the other way? Are they poking the person next to them in the ear because they're like,
Yeah,
have you ever seen that? Where do they put that person if they're not first
I
player?
would say that I actually haven't seen anyone play left-handed, and it's different than the guitar, because like guitar, usually you're not stacked up close to each other playing, like there's a lot of space.
Right.
And a lot of violinists, like when you're growing up, like as a kid, like you're going to be playing in groups, small groups, or like
Right.
orchestras. And so you can't have bows going, like, first of all, you're going to poke your stand partner's eyeball out.
Right.
But then also, like when aesthetically, like just the culture of being in an orchestra, all the bows have to be going the same direction, the same time. You can't have bows going different directions.
Yeah.
Like it's very synchronized. And so
Same with flute. I mean, I don't think I've ever seen
you can't play flute. Like you would be crossing flutes and knocking each other out all the time.
Yeah.
So I think just from a cultural perspective, like orchestral cultural, I mean, I actually haven't seen anyone play in a classical setting, at least, left-handed.
So then here's the big question. Concert band, symphony, orchestra, even quartets, you know, things like that, ensembles, adhere to exactly what you're saying. You learn that instrument because it is held a certain way. I don't understand why most left-handed drummers are set up backwards. I don't understand the concept of left-handed guitar or bass. I don't understand why to not do the same thing and just learn it that one way, because a left-handed piano player doesn't play like that.
Right.
Why, you know, I've never understood that.
Yeah, I don't really know. I don't have a good answer for you other than like the aesthetic portion of it and just like the culture of it. The pedagogy of it has never been as accepting of other ways of playing, right? Like
right. Well, the orchestra example, that all that I do understand. It's the left-handed guitar, bass, and drums that I don't get why you have to set up backwards. Just learn it the way it traditionally has been played. No matter what hand you favor, you need to be ambidextrous anyways.
Yeah, I see what you're saying. Yeah, I don't know, actually.
Yeah.
I mean, I think that the beauty of it though is that you can do it, right? Like
yeah, that's true too.
That's pretty cool. Like
whereas you have to be a conformist if you're a flautist or a string player.
I don't know. There's pros and cons, I guess, but yeah, I think if you learn left-handed, like my son, he just turned 4 last week, but he played like ever since he was like tiny. Like I have a picture of him when he was like probably like 1.5, and he plays his guitar left-handed, and like every time I'm like, oh, you know, like let's see, how do you feel when you switch? But he always gravitates back to left hand. But he's right-handed, like with everything. Or at least he's shaping out to be right-handed. But I'm like, like whatever, like we can. But I think people can learn to play left-handed with the same configuration as a right-handed guitar. I think that's what you're saying.
Yeah. Drums too. Yeah.
But maybe it's like because when you're strumming, like you strum from low to high, and so when you flip it, you would be strumming.
Well, it would be
high to low. Right. Yeah, so I don't know.
To me, the dexterity for a right-handed guitar, for me, there's at least as much dexterity on the neck as there is here, especially if you're not a classical guitarist, you're not finger picking a lot. You're picking with, I don't understand. Maybe someone could chime in and straighten me out. I'm not saying it's wrong. I'm saying I don't understand, you know? And then I saw
most people don't we just don't understand how brains work. I don't know how your brain works, but like,
thanks for at least giving me credit for having one.
But I mean, yeah, I mean, the brain works in so many different ways. And I think that's the really cool thing about just being human, that there's so many different ways you can approach one thing or one tool. And so I don't know. I think it's really interesting. I think it's interesting.
It is.
I don't have any answers for you, unfortunately.
That's okay. I was just kind of throwing the topic out there. One last note on that, and then we'll talk about injuries. And I got a good one for you, and that everyone should really pay close attention to. We do have one guess, but we need some more guesses. We have to have at least 2 guesses other than mine. So let's see. I was going to say I saw a singer holding a left-handed microphone in his right hand. So like, how does that work? Anyhow, let's go back to some basics that we've covered off and on all year, because this is something any musician should be familiar with and understand. Even if they don't do it, I think it's important to understand this quote science behind it, and that's stretching. So we'll talk about the difference between a dynamic stretch and a static stretch and when to do it, because a lot of people have it backwards, or they're doing crazy things that aren't even like really helpful stretches. They're more injury prone. You know, I've seen some drummers do some weird stuff with sticks, and I don't know what they think it's doing. Their arms get twisted up in a corkscrew 3 times, or it's like, what are you doing? You know, so I don't know. Straighten everybody out, starting with me, on what is the rule for stretching before playing and after, regardless of the instrument.
All right. So I love this question, because I think most people understand that stretching can be beneficial for most people, right? So there's 2 main types of stretching that people should be aware of. One is kind of like the traditional form of stretching, where you're holding it for a period of time, like 30 seconds or a minute, in one position, and then you let it go, and maybe you do it again a couple of times. That form is called a static stretch, because you're holding it in one position for that period of time. The other kind of stretching, that's kind of like a newer thing in concept, maybe like the last 15, 20 years or so, is a dynamic stretch, where it's like you're kind of going toward the end of your flexibility, but you're not staying there for too long. You're just kind of like moving in and out of the available range of motion. And so that is called a dynamic stretch, because you're not staying in one position for a period of time. Right. And so the thought behind when to do which kind of stretch is, you can do a static stretch. You can do a dynamic stretch most times. Like any time is like pretty safe. Okay. You can do a static stretch if you're looking to improve your flexibility. So dynamic stretch won't necessarily make huge gains in flexibility like a static stretch will. But let's say that you have tight chest, or you have tight hips. Doing a static stretch is really going to be teaching your body to expand that flexibility. But you don't want to do a static stretch right before you're going to start doing something intense, like not before you do like a big workout session, or if you're going to be playing a gig, like don't stretch all the muscles in a static way right before you go on, or start practicing. And the reason why that is, and it's maybe a little less consequential for most instrumentalists, because we're not dealing with like a lot of force that they're going to have to do. But the thought behind it is what we see is that when you hold a stretch for a period of time, immediately after, for just a very short amount of time, and this is not a bad thing, but you actually see a dip, a decrease in muscle performance. So the muscle isn't able to generate as much force as efficiently for a short period of time,
That
because
makes sense. It's like a recovery
everything's kind of
mode,
stretched
right?
out. So it takes a little bit longer for things to kind of contract again
Yeah,
to
okay.
create that. So you don't want to like do a quad stretch or a calf stretch and then go like do like a deep squat, like do a huge like leg workout
And then
immediately
jump on your
after.
drum set for an hour and a half show.
Yeah, yeah. So I would save a dynamic stretch for before you practice or play or before you work out. And then you can follow it up for sure with a static stretch at the end,
Mhm.
in any situation. So, but if
Interesting.
you're looking to make changes to your flexibility, static stretch is the way to go.
So that I don't remember learning that before, and the first thing I thought of was it sounds like a tie-in to the static yoga practices that therefore most people are more flexible if they practice yoga. So it's
Mhm.
kind of that same cause and effect, right?
I think so, if I understand. Yeah, I think so. But well, yeah. So kind of to your point, people who practice yoga on a regular basis probably are more flexible. And the way I like to think about it is that with the practice of yoga and like other movement forms too, but like let's just
Mhm.
use yoga for example, it's that like by going into those certain positions, you're asking your body to go into those positions. If you
Mhm.
think about what we do day to day, we sit in front of a computer, we're texting, we're playing, we're everything is kind of like inwards and closed.
Yeah.
The body never really has a chance to expand or open. And so it kind of gets used to being in this forward position.
Mm.
Whereas like yoga, you're kind of introducing, these different positions. And so your body still has in its like repertoire or in its wheelhouse those positions to be able to go into.
Interesting.
And so when you stop asking your body to do those things or to use that flexibility, your body is just going to kind of learn to be efficient in what you ask it to do, what positions you ask it to be efficient in.
That makes sense. Very interesting. Tai Chi as well would work the same
Yeah,
way.
yeah, yeah. Tai Chi is great.
Yeah. We are going to start practicing that real soon. So
Oh,
I'm eager
I
to
love it.
see the
I love it.
results. Yeah. That
Yeah, it's
was
really great.
Enja's idea. Yeah.
Yeah, yeah. There's so many benefits. I mean, most movement is good movement, right? And so
Yeah.
kind of like people were like, oh, should I do yoga? Should I do Pilates? Should I do this? I was like,
The
you know
answer is
what?
yes, right?
There's so many things. And I think I could tell someone, hey, you should really do Pilates, just for example, and like they hate it. And then if they hate it, they're not going to do it. So
Right.
I always tell people, like just find some kind of movement that you enjoy doing, that it doesn't feel like you're just having to like do this chore. It's like fun for you.
Yeah.
And that's a really great place to start. And then you can start expanding that like as you get stronger or more flexible or whatever your goals are through doing that. Yeah, you don't limit yourself to like two or three different options.
Great. I love that. Thanks. Because I know a lot of people have either assumptions about static versus dynamic stretching, which to do, when to do either one, or they're misinformed. And the
Yeah.
same thing for my next question, I'd like you to make sure everybody is straight on the difference between using ice versus heat. And in which cases would you use either one or both or alternate, and in which order, and that whole matrix.
Yeah, there's a whole yeah, there's a whole conversation about that. And it's kind of like they kind of go in cycles, right? And so sometimes ice is like really in vogue, like for a certain period of time, and then heat is really like popular. So from a physiological perspective, um, so there's different scenarios in which you would use different things. Okay, so if you're just talking about like a muscle spasm, like you pulled your back and it's just like really sore and you just kind of want some like pain relief, you can actually use either. You can use either heat or ice, and both of them work to help decrease the pain temporarily.
Mhm.
Just from a pain perspective. Um, from a muscle strain or muscle spasm perspective, a lot of people like to use heat because it just feels a little nicer versus like ice is like kind of stingy and like uncomfortable sometimes.
Yeah.
But you can really use either one. The only time I wouldn't use heat is if you have an area where there's like a lot of inflammation, like where it's like hot to touch, or there's
Mm,
actual like swelling in the area.
yeah.
I wouldn't fight fire with fire in that particular case. In that scenario, ice is probably the way to go because you want to minimize the swelling in the area. Because if you have some kind of acute inflammation, sometimes the swelling can cause more pressure, which will cause more pain, and then it just kind of like starts perpetuating this inflammatory cycle. So the
Hmm.
ice can work to decrease or minimize some of that swelling in the area. That would be kind of like the main time I wouldn't use ice. I mean, sorry, that I wouldn't use heat.
Heat. Yeah.
But in either case, most times either or is fine.
Interesting. What's your thoughts on? I know a lot of drummers, especially because they're more physical in
Yep.
their playing, that do like an ice bath after a gig. They come home or go to their hotel and they've got to get a really cold bath, often with the ice as well. Is that good, or is it just up to the individual? Is there
I
anything
think
to
it's
be
a
aware of?
yeah, so it's up to the individual. Like you're talking about like full submersion, right?
Yeah,
Like
yeah,
what an
like
athlete
laying
would
in a
do, like those like ice baths.
yeah,
That's what
even
you're
like a
talking about?
regular bathtub at a hotel, they fill it with
Yeah.
ice and water and they get in after a gig.
Yeah. So I mean that's up to the individual person. There's other like physiological benefits or effects, and I haven't like delved in like deeply into it, but there are physiological benefits to doing like cold plunges or ice baths,
Mhm.
um, that are maybe less like addressing any inflammation in that area, although you could. But if you're getting your body temperature to go down that much, your body reacts a certain way. So um, I'd have to do a little bit more reading before I talk about that more. But
O
there are people who like take like a bucket, like an ice bucket, and they just like put their whole hand in it. Or like sometimes like I'm kind of clumsy and so I'll like roll my ankle and like, it gets really swollen because it got sprained. And so I'll put my whole foot in like an ice bucket. And there is benefit to that because the pressure of the water surrounding the joint can also help to decrease some of the swelling in addition to the ice as well.
Mm, nice.
But you would not do it for too long, maybe like 5 minutes or so, because
Mhm.
if you do ice too long, you actually get the opposite effect. You actually get more blood flow after a certain point because your body kind of reacts that way to kind of counteract the decrease in blood flow.
Very interesting. I have a friend, and some people watching may know of Jamie Borden. He's a professional drummer and artist and producer. He's a retired, high-ranking police officer from Las Vegas. He lives in Las Vegas. He has a sauna and an ice bath that's outside, and he's
Yeah.
a few years younger than me. I'm 62 and a half. He's probably 56, 57, something, in amazing shape, like just chiseled and just really has his physique together. Every morning he does the sauna and then he goes into the ice plunge. He says it's life changing. It's a
Yeah.
life for him. It's been a life changing ritual. And quite frankly, I might be too weenie to do an ice bath. I mean, seriously, the most brave I've done with cold water was I was 40. No, what am I saying? I was in my 50s before I really got comfortable going into ocean water higher than my knees. And I
Oh,
started
that's
like
funny.
boogie boarding. And then in Australia, where I lived for 2 years, I did a lot of body surfing, 15-foot waves, and the water's cold and at 6 in the morning. And it was great. But an ice plunge, I don't know if that's too far for me. Have you ever done that?
So I have, and I was gonna. So fun fact is that I've actually been to Antarctica before.
Oh, I've
We
always
took a
wanted to go there.
Yeah, we took a trip. We took a cruise down to Antarctica.
Oh, wow.
It's not for the faint of heart because getting there is kind of crazy. But I did a Arctic. I went
Really?
into the waters in Antarctica, and that was pretty cold, pretty darn cold.
I mean, you lose your breath, right?
Oh yeah, like they have people like next to you, like so to make sure you don't just keep going down.
Right? Yeah.
But I've done ice baths, like I've done it like at the spa and stuff. I've done like
See,
cold
yeah,
plunges and stuff.
I've sat in the ice room. I go to a Korean bath spa in
Oh
Vegas.
yeah.
Well,
Uh-huh.
shout out to Imperial Spa. Love it. I go in the ice room and love that. But I don't know. Is it like, how would you describe it? Is it invigorating? Is it the after effect that's the biggest benefit? Is it while you're doing it? What?
I think it's kind of like for me, it's the after effect. And I think for a lot of people too. And that's kind of what I meant. Like there's a lot of physiological things that happen when you have that sudden like exposure to cold.
Mhm.
And so, you know, you get your adrenaline going, like your breathing change. Like there's a lot of stuff that I know that people actually have like what your friend like dedicated ice tubs sitting outside
Yeah.
that they have that as a general routine that they do, you know, every day or like a couple times a week.
Yeah.
So it is a thing.
That's
I
cool.
just don't know. I don't know enough about the science behind it.
Maybe I should sit at the grown-ups table and try it. Hey, folks, the show is winding down, and so far we have David W. Seymour, who's a frequent competitor in the Drum Talk TV Brilliance membership site Drumming Tribute Challenges. I had him on recently because he won one of the challenges. He has cast his estimate at 150 clients that Janice has
Oh,
seen
that
this
would be
year.
nice. That would be such a chill year. That
I,
would be nice.
yeah,
One day we'll get
I guessed 960. And we're looking for at least one other guest on either Facebook Live or YouTube Live. And the guest has to be from someone in the United States, and the guest has to be while we're live before Janice gives the number away. So we've got just a couple more minutes before that happens. So Janice, let me think of something else to ask you that would make sense to cap off a year of physical therapy advice for drummers and other musicians. What's some of the most or let's say for drummers, the most
okay.
preventative maintenance someone can do to prevent injuries other than, I'll say other than a few things to eliminate something. So other than the posture thing, get your ergonomics together, other than hitting too hard and gripping too tight and getting that shock wave up your arm. Without that one, just for general, someone who's got all that together, is stretching like one of the biggest things, whether they're slim and muscular or low body fat, or whether they're 100 pounds overweight? Is that sort of like a staple no matter what your body type is, if you've got all that other stuff
Yeah.
together? Or is it something else?
For drummers, I would say stretching because you're just sitting almost all the time, right? Whether you're in front of your kit, a lot of people who play music are also in front of a computer. You know, maybe they're like mixing or doing other kind of computer work, and just kind of culturally how we sit a lot. So trying to get yourself being able to have good flexibility, at least to like neutral, straight up and down. I think we kind of talked about that a little bit.
Yeah.
The other thing that I would say is building strength in the right areas. And so for most drummers, or at least like people who play in front of a drum kit, that would be trying to build up like the back. So like the lats, and like back muscles, anything that helps kind of like generate power, kind of going into the drum kit is going to be really important. And the last area would be to work on your cardio. So depending on the kind of music that you play, if you play something
Right.
really heavy versus if you're like a little bit more mellow, like a mellow jazz, like that, those are very different things.
Yeah.
But for drummers in general, like drummers are more, there's a higher cardiovascular demand than most instruments, I would say. So drummers especially need to kind of have that built up if possible.
That makes sense. And it leads me to one more question before Janice reveals how many clients she's seen this year, see if I'm even close. Or if David's close or someone else that's going to guess, and you'll win a shirt that we haven't even debuted yet. We've got some new designs. We have some newly fashioned designs of our old designed shirts, if that makes any sense. So you mentioned posture, and it is something we've talked a lot about, and strengthening the core and all that. So is scoliosis created by the person that gets it, or is it genetics?
Oh, that's a great question. So it could be either. Most of the scoliosis, so there's a structural scoliosis, which is what most people think of, like, you do the scoliosis checks when you're in middle school, right? You bend over and they kind of measure you.
They didn't have that when I was in middle school.
Oh,
in fact, it wasn't even called middle school. It was called junior high school.
Like when I was in school, I remember doing that too. But
Really?
you see like the kind of the curve, the S curve in the back.
Or the kind of this, right?
Yeah, so those are usually structural. Like as a child is developing, there can be, deviations in the spine. So that's something that there are exercises.
Program and show us exactly where we're talking about. Yeah, let's show people. I'll put it up there.
You want to put it up?
Check this out, folks. Ta-da! So Janice is going to explain exactly what scoliosis is and the couple different ways one could acquire it.
So if we look at the spine, normally the spine is supposed to be like straight up and down, right?
Right.
So scoliosis, let's see if I can scribble on here. Yeah, scoliosis. Sometimes the spine, instead of being straight up and down, it can have like a curve this way.
Mm-hmm.
Be crooked. And so that's kind of like the more typical kind of scoliosis that someone might see. So that usually is a little bit more structural. Sometimes there's scoliosis, let me change the angle of it, and this is more called kyphosis, not scoliosis, but, or if there's a combination of the two, there's kyphoscoliosis, but maybe there's more of a curve here. And the people aren't able to correct it. Like you and I, we probably could kind of curl ourselves up in a ball and get our spines to look like that. But the difference is that the people who have it structurally wouldn't be able to get out of that if they wanted to. I'll just move this guy over, pretend that's not there. So as a kid is developing, they can develop scoliosis, which can become structural from the bones, and also like the muscles that attach to it become a little imbalanced too. So it kind of perpetuates that position. But that's like structural. That it's hard to change that once it's kind of set. Sometimes you'll see kids in like braces where they'll try, as they're growing, they'll try and kind of like keep them from going into one position. So they don't kind of keep going into that curved position. There's also like exercises. There's a kind of a strategy. It's called like Schroth, where they do a lot of stretching or movements out of that curve to try and help counteract the progression of it or improve it. But that's structural. But there are cases of a functional, we call it functional scoliosis, meaning that the spine itself might be straight, like they can get in and out of it fine. It's just that where their body chooses to be might be a little bit of a curve. So like, I don't know if you ever noticed, but like for me, my left shoulder is always a little higher than my right.
Yeah, I'm like that too.
And everyone's gonna have like, oftentimes they say like, depending on your hand dominance, one side might be higher than the other. But my left side has always been higher than the left. Or sorry, my left side has already been higher than the right.
Let me see.
I don't have scoliosis. So if I just relax, like I'm a little bit lopsided. And I kind of attribute that to my like violin days where I have like my shoulder, and it's kind of like how my body has just calibrated itself. Like if I try and fix it, that seems very off kilter to me.
Same with me. I think it's my left side is higher
Yeah,
And
yeah,
and I am right hand dominated.
yeah.
This seems to slope down more.
Yeah, so there are
Huh.
instances where kind of your body's orientation to straight or to like a neutral alignment can be different than what is actually going on. And so that shift can cause like a curve in the spine, but
Mm.
that would be like a functional scoliosis because you can actually correct it. Like it's flexible. It's not you're not stuck in that position.
All right.
People who have structural scoliosis. There's like changes in the rotation of the ribs and like like there's it's really hard to kind of pull them out of that depending on the severity of it.
That makes sense. That's interesting. Thanks for sharing that. And one last call for comments. And I must say, in case you're seeing this not on the Drum Talk TV YouTube channel live, or not even on the Drum Talk TV Facebook page live because someone shared it into a group, you could be commenting in the group, but I don't see the numbers. So you have to click through and comment on the broadcast so I could see the numbers. How many clients do you think Janice Ying saw that were all musicians, that she treated for overuse, repetitive motion injuries? My guess was 960. We've only got one other guess, and I'm not eligible to win, and that's David Seymour guessed 150 clients. We'll hold off just a moment before we reveal that. We'll talk about what's coming the new year. I cannot believe it's going to be
I know.
2000 and whatever year it's going to be. 26 we're up to, I think now, right? Yeah. My baby
So. That's
sister
what
is
they
going to
say.
be 60. And if she's watching, she'll probably be mad for me saying that. But we're going to carry on. We're going to do the show once a month, and it's not always, it's usually on a Friday, and it's usually at noon Pacific time, 3 p.m. Eastern, 8 p.m. UK time, depending on the time of year there. But it's not always like the second Friday or the third Friday. So you got to watch for it. And if you follow Drum Talk TV, you'll see the promo graphics, hopefully. And we have a lot of fun doing this. Well, let me rephrase that. I have a lot of fun doing this. I don't know about
I do
Jen.
too.
Okay, I know I'm teasing, but we would love to see people ask questions and even talk about how, I've been playing 30 years and I've never had a problem with this, that, or any of the things you're talking about.
Great.
That's great, because then maybe Janice could ask questions that'll help reveal how you've avoided that, which will help other people as well. And that's why we do this show, to help other people. So no other comments. All right. What do we got, Janice? About how many or the exact number have you seen?
So I'll say that I appreciate you thinking that I work 48 weeks a year, but I don't. I took a couple months off sporadically. Okay. So my number of private patients that I saw this year was 639.
Wow, a lot.
Which was a lot. And that doesn't include some of the events that I did, because I didn't keep tally of it, of like where I'm kind of like just seeing people kind of rapid fire or just like quick consultations kind of thing. Yeah. So we're probably looking maybe more on like closer to 700 or like something like that. But that was a busy year. That was a busy year for me. So
that's
thank
great.
You for. Yeah, but I do have I always keep those numbers. So it's always good to reflect back on that.
Yeah. What percentage is online consultations and whatnot?
Ooh, let me see. That's a great question. I don't think I
David,
have that.
I'm gonna get David a shirt just for being the one that guessed. So David, you'll still get a shirt. Those won't be ready till January, but I'll make sure it's marked down. We've got your info from so many other wins and submission.
I don't have those numbers easily accessible to me, but it's actually not a huge. I used to do a ton more virtual visits, but now most people kind of come in, like they even like fly in to see me for like a day kind of thing. Like,
really?
Yeah. So I would say maybe like 10% were virtual this year. Not that much. Not that much.
I should have guessed. That was my guess I had in my head.
Yeah. Yeah.
Oh, wait, I could probably get a shirt.
You could get a shirt. I'll give you a shirt.
Okay, cool. We'll trade shirts. Awesome. Well, thank you so much. And everybody, thank you for following us, whether you saw just this episode or many other ones throughout the year. Hopefully it's been helpful for you and enjoyable. And Janice, thank you so much. And you can look Janice up. All her information, her socials and whatnot are in the post. Reach out to her if you have questions. And no matter where you live, she does do virtual consultations. So Janice, thanks so much. And happy holidays, everybody.
Happy holidays.
Thanks. Bye, everybody.
See you soon.
See you soon is right.